In today's video, we're going to talk about signs and symptoms that you can expect if you have lateral hip pain. And make sure you keep watching until the very end of the video, as I'll also go through some easy, practical, physical things that you can try to diagnose lateral hip pain from the comfort of your own home. And we're going to start right now. Let's dive straight into the video. Now, the best place to start is probably to try and figure out what it's actually called. Now, with many musculoskeletal conditions, it can often be quite confusing because there's multiple names given to the same condition, and this is no different. So it's often been referred to as trochanteric bursitis, gluteal tendinopathy, lateral hip pain, greater trochanteric pain syndrome. Now, the last name tends to be the one we use more frequently now, just because it's quite difficult to differentiate between whether it is more of a bursa related problem or more of a tendon related problem. Ultimately, it doesn't really matter very much because it's not going to change the management. We're going to manage the condition in exactly the same way. And it basically just refers to an irritation, a sensitivity, or maybe some inflammation in those soft tissues that sit on the outside of the hip. Now, that bony prominence that you can feel on the outside of the hip is the greater trochanter. It's the top of the thigh bone. And that bone is an attachment point for lots of different muscles and tendons, but also the bursa sits on there as well. And it just refers to sensitivity within those tissues. It is a condition that can affect both males and females, but tends to be a lot more common in females between the ages of 40 and 60. If that's you, then click the thumbs up button below the video. Now, it can come on because of a direct trauma, so a fall onto the lateral hip or a direct bump, but it tends to be a lot more commonly associated with overuse or some sort of change in load. So the first sign that you need to think about is, has there been any change in your routine or activity level? This is also absolutely vital when it comes to the treatment and management side of things. So if you enjoy walking or running, have you changed your mileage or distance? Have you changed your speed or the frequency of your runs during the week? You may also find that gradient has an impact on the amount of load going through the outside of the hip. So have you gone from walking or running on a flat surface to running up and down hills? If you work out, have you gone from doing low impact activity to higher impact activity that involves more jumping, hopping or landing activities? It may be that something's changed within your work that means you're doing more walking or standing or more stairs, for example. A change in load can also include weight gain. Now, this tends to affect soft tissues in two ways. The first one's pretty obvious. We all understand that the heavier we are, the more stress we have going through our tissue. So there's the mechanics side of it. But the more we learn about tissue health, the less we think this is relevant, and the more we think the second factor is relevant. And that is the way that fat is broken down or metabolized within our system. So when metabolism occurs within our bodies, fat is broken down, and a byproduct of that is an increase in inflammatory chemicals. So if we have more fatty tissue in our body, we also have more chronic, low-level inflammation within our system, which is clearly not good news for tissue and bone health. Another point to make in terms of lateral hip pain symptoms is that there is a huge spectrum of severity. At one end, you may be able to function very highly. You may be able to run 20 kilometers and get a little bit of stiffness in the lateral hip afterwards. At the other more severe end of the spectrum, you could have highly irritable symptoms, and you may even find weight bearing on the affected leg difficult. The first symptom is a pretty obvious one, so it's localized tenderness around the lateral hip. The caveat, however, is that it's not uncommon to get referred pain with lateral hip pain. So sometimes you may experience some pain into the anterior hips or the groin area. It may refer slightly into the buttock. You may find that it refers down the lateral aspect of the thigh and down towards the knee. If you palpate that area of tissue, you may find it uncomfortable. You can try this yourself, or you could get somebody to do it for you. If you wanted to do that, you would lie on your unaffected side, bend your knees slightly, and then just get somebody to push around the bony prominence on the outside of the hip. If that elicited pain or your symptoms, it could well be that you have lateral hip pain. Now that's a nice segue into the second symptom that we're going to discuss, which is lying on the affected side. We've just mentioned that applying pressure to that area of irritated tissue can be uncomfortable. So if you're lying on it, it stands to reason that it could bring on some pain. The other thing to mention is that you may also find you get discomfort lying on the unaffected side. Now, typically this condition does not like being stretched or compressed. So when you're lying on your unaffected side, you tend to find that the leg passes the midline of the body slightly, and that puts a slight stretch over the outside of the hip and those gluteal tendons. Some people find that that is also uncomfortable. If this is the case, one way that you can negate this is trying to sleep or lie down with a pillow in between your legs, just to try and raise the top leg up slightly to offload the lateral hip. A quick interruption just to say I've recently put a shop together with lots of different exercise motivation and medical myth busting t-shirts and hoodies just like this one. So if that sounds like something you'd like to wear down the gym, on your run, or even just down the pub, you can find a link to the shop in the description below the video. I really hope you enjoy the rest of this one. Now there are a number of videos on YouTube specifically for stretches and lateral hip pain. Now, the evidence suggests that one of the main treatment and management strategies should be to spend a period of time offloading the lateral hip by avoiding stretching and compressing the area. So unless you genuinely feel you're getting some pain relief from stretching, it's definitely something we probably want to avoid for a short period of time. Whilst we're on the topic of stretching and compression, other activities that could put you in these positions that you may want to avoid for a short period of time would be standing with a hitched hip. So that's standing with the hip out to the side slightly, the typical sort of position you might be in if you're holding a child or grandchild on the outside of your hip, or sitting in a low chair, a sofa, a sports car where your hip is at more than a 90-degree angle. This is also going to put more stretch and compression around those soft tissues. Anything that involves putting the affected leg across the midline of the body is also likely to irritate things. So sitting with your legs cross-legged or bringing your leg across your midline when you're getting out of bed, for example. You may also want to consider addressing things that put more load through the area. So things like standing for prolonged periods of time, walking for prolonged periods of time, stairs, jumping, hopping and landing type movements. Now, I did say at the beginning of the video, if you stay tuned until the end, I will take you through a few physical things that you could try at home to see if you have lateral hip pain. So let's take a look. We've already established one really easy thing that you can try at home in terms of a physical test is give it a push. Does it hurt? Another really easy thing that you can try at home is a 30-second single leg stand. So you're going to get onto the affected side, let's say the right side is the affected side. Very simply, can you stand on the affected side for 30 seconds without any pain? If you don't get any pain, it might be that we need to try some other tests. If you do get some pain, it could be that you have greater trochanteric pain syndrome. We mentioned earlier that a step up could be an aggravating activity, so you can give it a try at home. Bottom step at home, hold on if you need to. Affected leg on the step, you're just going to step up and back down. And if your symptoms are not that irritable, you may need to do a few repetitions to bring on some symptoms. If you did want to make it harder, then just stretch out the back leg further, and that's going to put more load through the outside of the hip. Stepping up to the side may also be uncomfortable, so you could try that as well. Again, hold on if you need to. Affected leg on the step, and you're just going to step down and back up. And that may be enough to bring on some symptoms. Same applies if you wanted to make it a bit harder, just take a wider step out to the side. You could also try to load the hip into resisted abduction. Abduction is this movement here. So for the purpose of this test, the left leg is the affected leg. You can hold on to something if you need to. You can just do this against the wall, be nice and easy. Just push into something solid, and you may find that the outside of the hip gets a little bit achy or sore. Now, this is an orthopedic test that therapists might do on you to see if you have greater trochanteric pain, but you definitely can do it yourself. And it's basically just to try and get this area on maximum stretch. So you're going to flex your hip, bring your knee towards your chest, bring your leg across the midline of your body, and then you're going to bring your foot and ankle towards you. Now that is going to put your glutes on maximum stretch, and if that is a provocative position for you to be in, that is indicative of lateral hip pain. Thank you very much for watching. I hope you found that helpful. If you did, I'd love to hear from you, so let me know in the comment section below what activities aggravated your lateral hip pain. If you did enjoy this video, you may like the video I have done on patellofemoral pain, and there's a whole playlist on the channel to help you manage your lateral hip pain better at home. Before you go, don't forget to like and subscribe to the channel so you don't miss any of our hip pain help, and I'll see you in the next one.